Hello, I'm Paula Russ, the Health Coordinator for the Kenton County School District. Thank you for participating in Kenton County School District's Medication Administration Training Program for non-licensed school personnel. I recommend you download the Medication Administration Training Manual before continuing this program. You can follow along in the manual as you watch this video and use the manual when you take the open book final exam. You will take the final exam after completing this training program. Depending on the format used to view this training, you will either complete the final exam online or print and bring the completed exam to a return demonstration where it will be graded. Training is not complete until the exam is passed with a score of 85% or above and a score of 100% is achieved on the skill competency evaluation. This training is divided into 4 modules that correspond with the modules in your training manual. You can stop this video at any time. Please help me maintain the integrity and the importance of this program. Do not share your exam with others. I recommend you view this video and the downloaded training manual in split screens on your computer. There will be page numbers on the bottom right of each slide that indicates the appropriate page of the training manual. You can take notes or print and use the study guides that start on page 65 of the manual to assist you with the final exam, which is open book. Okay, so let's begin the Medication Administration Training for non-licensed Kenton County School District employees. This course was developed collaboratively between the Kentucky Department of Education, the Kentucky Department of Public Health, and in consultation with the Kentucky Board of Nursing to ensure compliance with the Kentucky administrative regulations and regulatory statutes. The purpose of this course is to provide uniformity in training, improve safety, and reduce liability and remove educational barriers. A glossary of medical terms can be found on page 48 to 50 of the manual. Here is an overview of the training and the expected goals from the program. According to 702 KAR 1:160, Section 4.3G, beginning with the 2010-11 school year, all unlicensed school personnel who have accepted delegation to perform medication administration in school required proof of completing a training course provided by KDE. For many of you, this isn't the first time you've taken the training course since the training is only valid for the current school year. This is the official training course required for medication administration in Kentucky schools. Here's a breakdown of the modules in this training. A minimum score of 85% on the open book exam, which means you can miss 7 questions and still pass, and a 100% on the skill competency exam is required for successful completion. If you should fail either exam, you are allowed to repeat the failed portion once before having to repeat the course again. If you follow along in your manual with the PowerPoint lecture, you should have no problems in completing the open book final exam successfully. The first module discusses legal issues, policies, and procedures. There is more to administering medication than just handing a student a pill and keeping the medicine bottle in a drawer. There is an increasing number of students with chronic conditions or illnesses that may require medication at school. These may be scheduled times daily, over-the-counter medications for headache, or other emergency medications used in a potentially life-threatening situation, such as an EpiPen for an allergic reaction to peanuts or bee sting. School nurses are not always available to administer these medications. They could be at another school, on a field trip, or doing a medical procedure on another student. So many times, another school employee or unlicensed school personnel will administer medication. There is a potential for unsafe medication administration in each of these scenarios. This may result in an unsafe environment for these students and possible liability for the school district. So why discuss medication laws? We do this to reduce potential liability, increase safety, remove barriers, increase understanding and compliance. and now it's also part of the law. We will do a quick review of the laws related to medication administration. There are several laws that govern health services and medication administration in the school setting. For emergency medication administration, KRS 156.502 states that only physicians, registered nurse practitioners, and RNs may delegate and train unlicensed personnel. KRS 156.502 also grants liability protection under the federal Paul P. Covedale Teacher Liability Protection Act to those unlicensed personnel accepting delegation to perform medication administration in the school setting. KRS 158.838 allows for the training and delegation of unlicensed school personnel to administer emergency drugs, including diazepam rectal gel, also known as Diastat, glucagon, and Epipen. Only an MD, nurse practitioner, or RN may delegate to unlicensed school personnel. Additional statutory and regulatory references with web links can be found on page 63 of the manual. Physicians, dentists, and advanced registered nurse practitioners can prescribe medication. Nurses administer medications exactly as prescribed and cannot change the medication order without approval from the prescribing health professional. The title school nurse can apply to a variety of persons. In some states, a licensed professional may not be required. Each different nurse title involves different educational preparation and scope of practice. Educational preparation ranges from 1 year for a LPN to 6+ years for the advanced registered nurse practitioner. Our district uses both RNs and LPNs as school nurses. A LPN scope of practice prohibits independent practice and requires LPNs to work under the supervision and oversight of a designated registered nurse, physician, or dentist. This supervisor does not have to be physically present in the same building. The LPNs in the district do a great job, but they cannot delegate the performance of health services to unlicensed school employees. While the nurse transfers the performance of the task to an unlicensed school personnel, the nurse maintains accountability for the outcome to safeguard the health and welfare of students. So even when the school personnel performs the task, the delegating nurse retains the responsibility for the outcome. The unlicensed school personnel agrees to and has the responsibility to always follow the school district's policies and procedures and perform tasks in accordance with the training received from the delegating RN. Unlicensed personnel must also report to the nurse any significant information, or if they have any questions about a medication, or if they think they have made a medication error. Never assume, always ask the nurse. So in review, only registered nurses, advanced registered nurse practitioners, and physicians can delegate in the school setting and supervise the delegated trained person. Both KRS 136.502 and 201 KAR allow for delegation of select health services by these professionals to unlicensed school personnel. 201 KAR 20:400 requires periodic supervision, evaluation, and ongoing training of the unlicensed personnel by a qualified nurse. Supervision does not require the nurse to physically be present in the building, but does require the nurse to be available for consultation by phone. Although KRS 156.502 grants liability protection for unlicensed school personnel who accept delegation, the unlicensed school personnel is responsible to be familiar with and perform the delegated task in accordance with training received from the delegating RN or professional, as well as district's policies and procedures. As mentioned previously, the training course for delegation is valid for the current school year. The school year is considered July 1st to June 30th. No matter when in the year you complete the training, it is only good until June 30th. Confidentiality is an important legal concept and of utmost importance in health issues. If you have been to the physician recently, you have heard about HIPAA. That law protects your health information in that setting. The Family Educational Rights and Privacy Act, also known as FERPA, is a federal law that protects the privacy of students and their educational records. Health information and health records are protected by FERPA in the school setting. Health information should be shared with other school personnel only on a need-to-know basis and never with other students or the general public. If a student shares private information with an unlicensed school personnel, this information can be shared with the nurse but not discussed with others who have no need to know. Health plans are used to give more detailed information on a student with a medical condition. If your school nurse has shared a student's IHP with you, please keep the information confidential. Substitute teachers need to know this information as well. When a nurse shares an IHP with you, you will be given instructions to black out the identifying addresses and phone numbers on the first page of the document and put this altered IHP in your subfolder. A copy of the unaltered document with all student information visible should be kept in the emergency bag. This will ensure information accompanies the student at all times. All school districts should have written policies and procedures on medication administration. The Kenton County School District does have a written policy on student medication. It can be found on the district's online policy procedure manual under Chapter 9 Students. Medications are also addressed in the Kenton County School District Code of Expected Behavior and Conduct. Some of the important points in the policies and the procedures include: no medication will be administered without proper district forms being completed by both the physician and a parent. No MD notes or notes from parents can be accepted at any time. No changes can be made to medication or dosage by a parent. Any changes in medication administration requires a new form and a new labeled prescription bottle. The district utilizes a medication administration form that includes permission for students to self-carry and self-administer medication. A medication administration record that includes a medication count for controlled medications and a medication error form. Medications must be sent to the school in the original labeled container. And storage of medication is in the nurse's office in an appropriately labeled, locked, and secured safe. Emergency medications are kept in the nurse's office, available for use during the school day, but are locked at night. This is the Medication Administration Permission Form. Our district requires both a parent and a physician's signature on the form. The original pharmacy label must include this information. The expiration date is very important, as a medication can never be administered beyond the expiration date. Over-the-counter medications also require medication administration permission forms. Students are allowed to carry and self-administer specific medications in our district if the proper authorization form is on file. These medications include inhalers and emergency medications, Diastat, glucagon, and Epipen. Tylenol, ibuprofen, and other over-the-counter meds may not be in a student's possession. It is best practice that if a student does carry a medication, that an additional supply is also kept in the nurse's office for certain availability. The Kenton County School District policy states parents, guardians should bring medication to school. We can't prevent this from happening, and frequently medication is sent to school with the student. If this does occur, the medication needs to be taken to the nurse's office as soon as possible. For the safety of all students, we cannot give any medications to students to transport home at any time. Medications must be picked up by a parent, guardian, or an adult. Oftentimes, medication may need to be at various sites to accommodate after-school care. Parents need to make sure arrangements are made so that students are not transporting medications. Check medication expiration dates, especially emergency meds that are self-carried. This is especially important for coaches because health services doesn't routinely see these medications. Medications cannot be administered beyond their expiration date, and medications can never be sent home with a student. Authorization to administer medications is only valid for the current school year. Changes require a new medication administration form and a new properly labeled bottle. Except for emergency medications, all medications in our district are labeled and stored in a double lock safe in the nurse's office, accessible only to authorized school personnel. For disposal of unused or expired medications, pills should be mixed with glue in liquids with cat litter, sand, or coffee grinds for disposal. Do not flush unused medication down the toilet or sink. If a student is attending a field trip away from school, a designated trained person must accompany any student who may need medication administered. The trained, unlicensed school personnel must stay with the student in case the medication is needed. Unlicensed assisted personnel cannot give medication to another school employee or parent chaperone to administer. Advance notification for field trips is very important to make sure trained personnel is available to attend if needed. It is very important to return any medication or empty containers back to the nurse at the end of the field trip. Depending on the circumstances, the medication administration record may not be sent on the field trip. Remember to always document after the medication is given, so you may need to do this once returning to school. Once the field trip returns to school, return the medication bottle to the school nurse and complete the documentation. If a student has an individual health plan due to the medical condition, make sure the document accompanies you on the field trip. A student with emergency medication needs to remain with the person trained to give it when on field trips. The scope of practice and delegation rules specific to the state need to be taken into consideration for field trips. For this reason, trained personnel may be responsible for the storage of medication, but the student may self-administer with trained personnel supervision. I would like to take a few minutes to review the field trip request and parent permission forms used in the Kenton County School District. If you are planning a field trip, please adhere to the timelines indicated on the planning checklist. It is imperative that the school nurse is involved well in advance so that the medical needs of the students can be properly addressed. If a list of students attending the trip is available, please include that with the request. A medication-trained person is required for all field trips, and a backup or two is highly recommended. These people should be listed on the field trip request form. The school nurse needs to sign all field trip requests. The nurse will indicate a date when parent permission forms are needed to be returned to her for review. The deadline is 2 weeks before the date of the field trip. If school is closed during this 2-week period, the deadline will reflect these days. Ample time is needed to get all required documentation for medication to be administered. Keep in mind, medication not normally given in the school day may become a factor for extended field trips. When the teacher gives the field trip parent permission forms to the nurse, they should be given as an entire group at one time with a student list. If parent permission forms arrive after the due date, the school principal will have to approve before the nurse will review the form. It's amazing how students can be in school for months without medication, but field trip forms indicate previously unknown medication and medical conditions that we now have to address in a short period of time. It is a student's right to refuse medication. This is not a medication error. Document the refusal of the medication on the administration log. This documents the medication was offered as ordered. The school nurse and parent is to be notified as soon as possible. If a student refuses their lunchtime medication and wants it later, or the dose was missed before they left home in the morning, the medication cannot be given. Medication can only be given 30 minutes before or after the time it was ordered. Medication errors are serious and occur when any one of the 6 rights of medication administration have been violated. The wrong student, the wrong medication, the wrong time, the wrong dose, or the wrong route. Failing to document or inaccurate documentation of a med that has been given is a medication error and may lead to overdosing a student when the medication is given by someone else who is not aware that it was already administered. The potential for any of these errors exists in the school setting, especially the wrong medication, such as switching Motrin for Tylenol. They are not interchangeable, and some students are allergic to one or the other. The wrong time, remember 30 minutes before or after, and failing to document is an error. If you are ever unclear about administering a medication, do not give the medication and contact the appropriate person. What to do if a medication error occurs. You need to keep the student in the health room, or if they're back in class, send someone to get them. Observe and document their status. Identify the type of error. Notify the principal and school nurse, who will notify the parent and healthcare provider, and complete a medication incident report. This is a medication administration incident report. It needs to be filled out completely and signed by the appropriate people. This completes Module 1. In Module 2, we will review the different types of routine medications. There are 3 types of medication: controlled, scheduled medication such as Ritalin, Adderall, or Tylenol with codeine. These are potentially addictive and regulated. They can only be obtained with a written prescription, must be kept under strict double lock and key, must be signed out every time a dose is administered, and then counted and record the remaining number of pills on the student's medication administration record. Non-controlled, scheduled medications such as Tegretol or Dilantin, both anticonvulsants, still require a prescription and must be stored in a locked and secured container. Documentation of administration is also required. Over-the-counter medications, OTC, our district requires an authorization form to administer any medication, including OTC meds. These customarily are medications that are given on an as-needed basis, or PRN. Scheduled means a specific time is prescribed, such as Adderall 10 milligrams, 1 tablet by mouth at lunch or 12 o'clock. You will see abbreviations on many of the medication orders. Page 47 of the training manual has a more inclusive list of abbreviations. Pages 24 and 25 of the training manual give you names of common medications administered in the school setting. Remember, a medication may have a brand and a generic name. For instance, the generic name for Advil is ibuprofen. Medication orders and prescription bottles may have different names for the same medication because a generic was given. If ever in doubt, don't give the medication and call the supervising nurse. Page 55 of the manual has a list of brand and generic names for common medications. All medications have the potential for unwanted, unexpected, and/or dangerous reactions. Reactions can range from nausea and vomiting to allergic reactions such as redness, a rash, itching, or in the most extreme, anaphylaxis, which is a life-threatening allergic event. Emergency procedures should be implemented if anaphylaxis is suspected. Observing a student after a medication is administered is important. Some medications are best taken with food, so if ordered after lunch, make sure the student actually ate their lunch to prevent nausea and vomiting. This is a website for information on adverse drug effects. I also recommend mayoclinic.com. If vomiting occurs after taking a medication, report to the supervising school nurse and have this information available. If the student experiences a severe anaphylactic reaction, treat it as an emergency and follow district policy. Different forms of medications are seen in the school setting. These include oral, topical, inhalers and nebulizers, and emergency medications. Oral medications come in many forms and are taken different ways. All tablets or capsules should be taken with liquid. Chewable tablets are meant to be chewed before swallowing. Tablets may be scored or have a line on them. This indicates the medication is evenly distributed in the tablet and may be broken or split to reduce the dose. Unlicensed personnel are not allowed to split these scored tablets. Enteric-coated tablets are coated to protect the stomach from irritation. The coating dissolves in the small intestine. These should not be split or crushed. Sublingual medication dissolves under the tongue, and buccal medication dissolves in the cheek. Capsules are coated to dissolve over a period of time. They are a delayed release. Do not break or crush any medication considered extended or controlled release. These are usually identified by EX, ER, CR, LA, or SR. Oral medication should not be crushed without a licensed practitioner's order. Directions on the bottom will indicate directions on the bottle will indicate if a medication should be crushed, sprinkled, etc. Syrups, elixirs are clear. Suspensions are liquids that are not clear. They usually require refrigeration and need to be shaken for 15 seconds before administered. Here are the proper steps for oral medication administration. You have the right to ask the student to demonstrate if they have swallowed the medication. Topical medications include eye or ear drops, creams, and ointments. Eye drops or ear drops are liquid given through a dropper because a small dose is needed. In adults or older students, the earlobe should be held up and back before instilling the drops, and for children, the earlobe should be held down and back. After instilling the proper number of ear drops, you or the student should press on the ear flap and the head should remain tilted for several minutes to give the medication time to coat the ear. Do not insert a cotton plug into the ear unless the physician's orders indicate to do so. Directions on eye drops will indicate if they need to be shaken before administering. Eye drops should not be dropped directly onto the eyeball. Instead, gently pull down the lower eyelid to create a small pocket and instill the drop there, or you can put the drop in the corner of the eye and have the student roll their eye to instill the drop. Ointments and creams are applied externally to the eye, ear, or skin. Always wear gloves when administering topical medications and wash your hands before and after use of the gloves. All gloves supplied by the school district are vinyl to protect students and staff that have latex allergies. Be aware of the correct route and the dose for these medications. Inhalers include nasal sprays, oral inhalers, and especially for younger students, a spacer may be ordered to assist the student in receiving the proper amount of medication. Nebulizers atomize the prescribed medication. If you're responsible for administering medication via a nebulizer, individual training on how to use the machine will be provided. The most common problems encountered with inhaler uses are not taking the medication as prescribed, incorrect activation, not timing the inhaler and squeezing the canister properly, forgetting to shake the canister before administering, and not waiting long enough between puffs. A minute between puffs at minimum or longer if directions indicate. This is especially important for athletes. If the inhaler is not taken properly, the medication will not effectively treat the symptoms and further respiratory compromise may develop. If a student needs their inhaler more frequently than orders, which is usually every 3 to 4 hours, this can signal respiratory problems. Call the supervising nurse for further instructions or have the athletic trainer evaluate the student-athlete. Inhalers may be carried and self-administered by students. If you witness a student administering inhaler, please contact the school nurse to ensure proper medication administration permission is on file. Additionally, this ensures the medication is given as ordered and can be documented in the medication administration record. Inhalers should not be shared. This is a common problem in the school setting with students that self-carry their inhalers. Here are 2 quick videos about inhalers and spacers.
Using a metered dose inhaler. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Without the inhaler, take a breath and breathe out all the way. Hold the inhaler upright. Put the inhaler in your mouth, above your tongue, and between your teeth. Seal your lips around the inhaler. Begin to breathe in slowly. Press down on the inhaler 1 time and keep breathing in. Hold your breath for 5 to 10 seconds. Open your mouth and breathe out slowly. Using a metered dose inhaler with a spacer. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Put the inhaler mouthpiece into the end of the spacer. Inhale a deep breath and breathe out all the way. Hold the inhaler and spacer between your pointer finger and thumb. Put the mouthpiece of the spacer in your mouth and above your tongue. Close your lips around the spacer. Tilt your head back a little bit. Press down on the inhaler 1 time and breathe in slowly and deeply. Breathe in all of the air you can and hold for 5 to 10 seconds. Open your mouth and breathe out slowly.
The emergency medication Diastat, Epipen, and glucagon will be discussed thoroughly in the next module. These 3 medications may be self-carried and possibly self-administered by students in the Kenton County School District. Here is some important information about handling medications. Soap and water is always preferred, especially if hands are visibly soiled. When administering liquid medications, adhere to these guidelines. You may need to bend down to keep a measuring cup on a solid, level surface in order to measure at eye level. Try to maintain the integrity of the label so the directions can be read. Liquids have different thicknesses, so do not layer one medication in with another one in a measuring cup. Use a separate cup for each liquid medication. To ensure that medication errors don't occur, follow these steps. These are the 6 rights of medication administration. You need to double, even triple check each one of these rights every time you give a medication to a student. It is recommended that 2 forms of identification is used to ensure the right student is receiving the medications. Our district policy allows for medications to only be administered 30 minutes before or after a dose is ordered. Any time earlier or later is a medication error. All medications administered by school personnel must be documented after it is given on the log with the initials of the person administering the medication, with the dosage, the time, and the date. This also includes medication administered on a field trip. Failure to document or inaccurate documentation is a medication error. This might cause a second dose to be given as a result, thus overdosing the student. All medication errors must be reported to the nurse as soon as possible and a medication administration error incident form completed. When administering medication to students, there is some important information that is needed. It is very important to be aware of the presence of allergies. This information should be included on the medication administration log. You will not be able to see general student allergy information in Infinite Campus. Only health information for the 3 emergency medications show up on the summary page of Infinite Campus. Always call the school nurse if you ever have a question about medication administration. Never assume. Documentation should be in ink, not pencil, as this is a legal document. And do not use whiteout. If an error is made, strike out, write void, initial, and date the error. This is the Kenton County School District Medication Administration Record. As you can see, it has all the information required. After a medication is given, the appropriate box is marked with the time of the administration, the initials of who administered it, and at the bottom of the page, put the signature that corresponds to the initials. Additionally, there are codes for common used terms. This is the back of the medication administration record, where medication counts can be made for prescription medications, and additional notes can be documented, such as when an empty bottle is sent home. Again, put corresponding signature to your initials. Here is a quick review of practices and administration techniques associated with routine medications. The following information can be found in the handout section of the training manual, which starts on page 46. Proper hand washing is an essential first step in preventing disease and before preparing to administer medications. Sanitizers or an excellent alternative if soap and water are not available. Each time a medication is administered, check the 6 rights. Frequently check the medication to prevent errors. Here's a review of oral medication administration. A review of liquid medication administration. A review of eye drops and ointments. This is a review of eardrop administration. A review of topical medication application. Remember, wear gloves to protect yourself from bloodborne pathogens or use a mechanical means, such as having the student use a Q-tip or apply a Band-Aid with the medication already on it to avoid exposure. Review of nasal sprays. And here is a review of meter dose inhalers. A meter dose inhaler is a pressurized canister of medication that is sprayed through a mouthpiece. You can help a student follow these simple steps to properly use their inhaler. This completes Module 2 of the Medication Administration Training on Routine Medications. Module 3 begins information on emergency medications, Epipen, Diastat, and Glucagon. KRS 158.838 allows delegation by health professionals to train unlicensed school personnel to administer these medications. It also requires each school have at least one employee on duty during the entire school day to administer emergency medications. The entire school day is a vague guideline, and the Kenton County School District interprets this to include any school-affiliated activity. Here are general guidelines for emergency medications. They should be labeled and stored at room temperature in a secure but accessible location. The expiration date should be checked monthly, and parents should be notified 1 month in advance of expiration. A medication cannot be administered beyond the expiration date. Designate someone to call 911 if administering emergency medication in the school setting. Give this person ownership of the task. Do not say, "Someone call 911." Call the person by name or describing characteristics so they know the job is theirs. This person should also meet the emergency medical team at the entry point to the site and escort them to the student. After the medication is administered, give the used kit to the emergency medical personnel. If you are a coach and have a student that self-carries an emergency medication or an inhaler, it is recommended that you know where the medication is kept and actually look at it from time to time. Make sure the medication has not expired and that all the equipment is available should the need arise. Some coaches have told me they use a buddy system for students with self-carry medications, and they always have the person with the emergency medication put their gym bag by this buddy. If the need for medication arises, you know what gym bag to look for. Remember that nurses don't see the self-carry medications and that it is not guaranteed that the student will always have it with them. Be prepared. The first emergency medication we will review is glucagon. It is available to people with diabetes. Diabetes is a condition where the body is unable to produce insulin. Glucagon is the emergency medication required for diabetics experiencing extremely low blood sugar. There is 2 types of diabetes, insulin-dependent and non-insulin dependent. The majority of students have type 1 and are insulin dependent. It is not related to eating too much sugar. The true cause is unknown and may be viral in nature. Type 2 is linked to genetics. Glucagon is a hormone to treat severe hypoglycemia. Hypoglycemia is another name for low blood sugar and is the most frequent complication for students with diabetes who require insulin. Causes of hypoglycemia can be too much insulin, too little food, delayed eating, physical activity, illness, or alcohol consumption. Students will test their blood sugar before or after physical activity, such as gym or recess, to prevent hypoglycemia. For extracurricular activities, a change in the student's normal activity level or delay in eating, such as if a game is delayed or goes into overtime, will affect the student's blood sugar level. If you want to avoid having to administer glucagon to a student with diabetes, encourage them to check their blood sugar frequently and carry snacks such as a juice box or Skittles to avoid a severe hypoglycemia event. Severe hypoglycemia symptoms include sleepiness, loss of consciousness, and seizures. Glucagon is administered when a student with diabetes is unable to swallow or take liquid or food by mouth. Anytime a diabetic student has a complaint or symptom of low blood sugar, they should be sent to the nurse accompanied by someone. This can be a student. Additionally, students that ride the bus test their blood sugar before dismissal to make sure their blood sugar is adequate. Remember, if they have low blood sugar, it can be treated with food or liquid containing carbohydrates to increase their blood sugar. Glucagon is only used if they are unconscious. Here are the steps to administer glucagon if a diabetic student is unconscious. Before administering any emergency medication, you need to identify and designate a person to call 911. Assess the kit prescribed for this student. You may have several students who require emergency medication. Be sure you are administering the correct medication to the correct student. The amount of glucagon to be administered is on the prescription label. Weight is used for determining the accurate dose. Elementary age students can receive 1/2 or 1 ml, and middle and high school students generally receive 1 ml. You can inject the glucagon into the arm, leg, or buttocks. Clothing does not need to be removed. Return the used syringe to the kit and close the lid. Stay with the student and monitor the student on their side, observing for nausea and vomiting, which is a side effect that may occur. Give the used kit to the emergency medical personnel. If the student revives, you may give them a snack when alert enough to swallow, but usually the EMS has already arrived before this time. Here is a review of glucagon administration. This is what you will need to demonstrate at the return demonstration to show you're competent to administer the medication.
How to use the Glucagen Hypo Kit. When a person with diabetes has severe hypoglycemia, he or she is not able to treat him or herself and needs help from others. That means someone else has to give the glucagen injection. Therefore, it's important that friends, family, and co-workers know how to use the Glucagen Hypo Kit before an emergency happens. In the following sequence, you will see how to use the Glucagen Hypo Kit. Step 1. Open the Glucagen Hypo Kit case. Remove the glucagen vial and syringe from the kit. Step 2. Take off the orange plastic cap from the vial. Pull the needle cover off the syringe. Step 3. Insert the needle through the rubber stopper of the vial containing glucagen and inject all the liquid from the syringe into the vial. Step 4. Without taking the syringe out of the vial, gently shake the vial in your hand until the powder is completely dissolved and the solution is clear. Step 5. While the needle is still inside the vial, and while keeping the needle in the liquid, slowly withdraw all the liquid into the syringe. Be careful not to pull the plunger out of the syringe. This will also help minimize the leakage of the fluid around the syringe. The usual dose for adults and children weighing more than 55 pounds is 1 milliliter or 1 milligram. Therefore, withdraw the solution to the 1 milliliter mark on the syringe. The usual dose for children weighing less than 55 pounds is 0.5 milligrams, 1/2 the adult dose. Therefore, withdraw 1/2 of the solution from the vial to the 0.5 milliliter mark on the syringe for these children. Discard the unused portion. Step 6. Turn the patient on his or her side. When an unconscious person awakens, he or she may vomit. Turning the patient on his or her side will prevent them from choking. Step 7. Without removing the needle from the vial, and while keeping the needle in the liquid, remove any air bubbles in the syringe by flicking the syringe with your finger and squirting any air bubbles out of the needle into the vial. Step 8. Continue pushing the plunger until you have the correct dose as described earlier. In the event the plunger is pushed below the required dose, pull back the plunger until you have the correct dose. When you have the correct amount of glucagon in the syringe, pull the syringe from the vial. Step 9. Insert the needle into the loose tissue under the injection site and inject the glucagon solution. There is no danger of overdose. Step 10. Withdraw the needle and press on the injection site. The used syringe and needle should be placed in a sharps container, such as a biohazard container, a hard plastic container such as a detergent bottle, or a metal container such as an empty coffee can. Such containers should be sealed and disposed of properly. Feed the patient as soon as he or she awakens and is able to swallow. Give the patient a fast-acting source of sugar, such as a regular soft drink or fruit juice, and a long-acting source of sugar, such as crackers and cheese, or a meat sandwich. If the patient does not awaken within 15 minutes, give another dose of glucagon and inform a doctor or emergency services immediately. Even if the glucagon awakens the patient,
Anaphylaxis is a life-threatening allergic reaction that could be fatal in minutes. A variety of allergies can result in this reaction. Food such as peanuts or seafood, stinging insects such as bees or wasps, latex, and exercise. Of course, in our school system, peanut allergies are the most prevalent. Many classrooms are indicated as peanut-free, and peanut-free tables are available in cafeterias if needed. The symptoms range from mild skin reactions to quickly progressing severe reactions. The severity of the allergic reaction is difficult to predict, and the allergic response may rapidly progress to become life-threatening. Epipen is a prescribed medication containing epinephrine to reverse the effects of anaphylaxis. The amount of epinephrine is based on the student's weight. EpiPens are not interchangeable between students, so check the label before administering. Once administered, epinephrine is effective for only 10 to 15 minutes. EMS needs to be notified. Students are permitted to self-carry and self-administer an EpiPen. Check the label on the kit for the right student. The kit delivers the correct amount automatically. They are dispensed in 2 packets, but oftentimes parents only send 1 dose to school. Remember, the first step is to identify someone to call 911. Do not touch the orange tip. Keep your thumb off the end. It is not necessary to remove the student's clothing before administering an EpiPen. Remove the blue cap and grasp firmly in your hand, wrapping your thumb around your fingers. Swing and firmly jab the orange tip against the outer thigh until it clicks. Hold the EpiPen against the thigh for 10 seconds. Remove, then lightly massage the area. Return the unit to the kit and give the used kit to the EMS. There is another epinephrine delivery system called an AviQ. The delivery of this will be reviewed in the video that follows. These videos demonstrate what you will need to demonstrate at the return demonstration to show you are competent to administer the EpiPen.
I'm allergic to nuts.
I can eat strawberries. Milk doesn't like me.
Mommy says I got an allergy.
I get all red and bumpy. My eyes get puffy like this.
I don't breathe so good. My tongue gets itchy.
It made me really scared. This is my
EpiPen.
EpiPen.
My EpiPen.
Take it out of the case and pop off the cap.
Make a fist like this.
Like this. Kids like me sit on laps.
Bigger kids sit or lie down. Here's a spot, just hold my leg still. Press, click, and hold.
Be sure to hear the click. Hold it there for 10 seconds. That's 10 seconds.
Always have an extra EpiPen ready because the medicine can wear off.
Then call 911. Easy, white.
Today, doctors are seeing more and more children with allergies, especially food allergies. In a room of 20 kids, one or more of them will have allergies. While most allergic reactions result in merely uncomfortable symptoms, some anaphylactic reactions may be more serious and even life-threatening. About 150 children and young adults die from food allergies every year in the United States. Due to the unpredictable nature of allergic reactions, over 2.4 million epinephrine autoinjectors, such as this, are currently being prescribed. EpiPens deliver medicine quickly and effectively, but they only work if there is somebody around who knows where the pen is, when to use it, how to use it, and will actually do it. Times when you need to use an EpiPen can be stressful and may even be life-threatening. So it is important to have a plan of action so you can calmly react to the situation. Knowing when to use an EpiPen can be easy. If a child eats something they're allergic to, has hives, and is wheezing, give the shot. Sometimes, however, symptoms may not be as obvious. So if you are in doubt, always give the shot. You may not even have known what the child has eaten. But if you do suspect an allergic reaction, or a child is demonstrating 2 or more symptoms, don't wait. The longer you wait to administer an EpiPen, the harder it is to stop an allergic reaction, mild or severe. And allergic reactions can change from mild to fatal quickly. No child has ever died or has had serious problems from a standard dose of epinephrine. To protect the child in your life, be prepared. Memorize these steps and practice them. Review each child's action plan, know where each child's EpiPen is, locate it. Epi equals 911. If you get it, call it. Take the EpiPen out of its case. Hold it in a firm fist grip. Remove the cap. Make sure the child is sitting or lying down. Identify the big muscle in the thigh. Hold the leg and the child steadily. Press the orange part firmly against the thigh so that it clicks. Stay there. Don't bounce. Hold for 10 seconds. Press, click, and hold. Some of you may have an epinephrine injector that looks like this. This training device has yellow caps, but yours may have a different color. This has the same medicine as the EpiPen, the same kind of spring-loaded needle, and is used for exactly the same reasons. This injector has 2 safety caps. Hold the injector in a fist grip. Don't put your thumb on either end. Remove both safety caps. The red end is the action end. That's where the needle comes out. Remember, red to the leg. The red end should not touch anything else. Again, make sure the child is sitting or lying down and hold for 10 seconds. For this device, the needle will remain exposed after use. Please put it down carefully or put it back in the case. And if you haven't done so already, call 911. As with any emergency medication or device, please be familiar with it before you need to use it.
Oh, hey, I'm Ben. And this is AviQ, the first and only epinephrine auto-injector with voice instructions for adults and children with severe life-threatening allergies. Did you get all that?
Good. Now, in case of an anaphylactic emergency, here's what you do. First, pull AviQ out of its case.
If you are ready to use, pull off red safety guard. If not ready to use, replace the outer case.
We're ready. Okay, red safety guard, give it a good pull.
To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
AviQ should only be injected into the middle of the outer thigh. Also, feel free to leave your pants on. AviQ will still work. However you know it's working, you'll hear a click, then a hiss. The needle will retract on its own.
But remember, do not remove AviQ until the 5-second countdown is done.
5, 4, 3, 2, 1. Injection complete. Seek emergency medical attention. This device has been used and should be taken to your physician for proper disposal and a prescription refill.
Seek medical attention immediately afterwards and have a doctor check you out. And that's it. I hope this helped. And don't forget to always keep your AviQ on you.
Epilepsy is a neurologic disorder that causes recurrent seizures. Not everyone who has a seizure has epilepsy. Seizures are caused by a disruption in the brain's electrical activity. Seizures take many forms depending on where the disruption occurs in the brain. There are general tonic-clonic seizures, also known as grand mal seizures. These are very obvious convulsions with muscle rigidity and jerking. There are absent seizures or petit mal seizures, which are characterized by a blank stare that can last a few seconds. People might also blink or chew when having a petit mal seizure. You may not even know when someone is experiencing this type of seizure activity. A complex partial seizure is a random activity and a student is out of touch with their surroundings. A simple partial seizure is jerking in one or more body parts and may not be obvious to the onlookers. Atonic seizures cause sudden collapse with recovery in minutes. In myoclonic seizures, a sudden, brief, massive jerk involving all or part of the body will be observed. Not all seizures are convulsions, and the student may not lose consciousness. Seizures can last anywhere from a few seconds to a few minutes. If it extends more than 5 minutes, the seizure is considered significant. First aid measures during a seizure. The first 2 priorities during a seizure are maintaining breathing and airway patency and safety. The floor is the safest location for a person experiencing a seizure. Stay calm. Protect them from injury by moving harmful objects away from the person having a seizure. If other students are in the room, clear the room if possible. If not possible to clear the room, have other students turn their back. Seeing a seizure can be frightening, and a student experiencing a seizure needs privacy. During a seizure, a person may lose control of their bowels or bladder, and they may vomit. Cushion their head with a jacket or other soft object. Never put anything in the mouth of a student experiencing a seizure, and do not restrain them. Attempt to roll the person on their side. This keeps the airway open and protects the airway if a person vomits, which is a frequent occurrence. Loosen tight clothing around their neck and note the time the seizure began. Stay with the student, call 911, and administer meds as ordered if the seizure lasts longer than 5 minutes or another time frame if indicated on the physician's order. It is normal for a person experiencing a seizure to become pale or slightly blue. Monitor their breathing and airway. I know there is an urge to call 911 at the onset of a seizure, but for people with a history of seizures, this is not an immediate need. Additionally, the medication for seizure control is not given immediately unless it is ordered that way, which is very rare. Most seizures resolve after 1 or 2 minutes. When is a seizure an emergency? If a seizure lasts longer than 5 minutes, that is why you note the time it started. We are not surprised when a student with a history of seizures experiences a seizure. Allow the seizure to run its course. Repeated seizures without regaining consciousness is an emergency. If a student has been injured or is a diabetic, if it is a first-time seizure, if the student has breathing difficulties, and if the seizure has occurred in water. Here is a review of the priorities. Remember, not all seizures are convulsions. There are many different forms, and not all seizures result in loss of consciousness. Diastat is the emergency drug used for seizure control. The dosage is ordered by the physician and is locked in by the pharmacist. Make sure the green ready band is visible. Check this when receiving the medication before you need to administer the medication in an emergency. Again, especially for coaches that frequently deal with students that self-carry, it is important to see the medication to check that it is ready for use. If you do not see the green ready band, the medication is not properly locked. Do not accept this medication or use the medication. Notify the nurse. Diastat administration. Identify someone to call 911 if administering the medication. Put on gloves. These are not supplied by the manufacturer, so make sure they are added to supplies the student self-carries. Get someone to help you. Remember, you have 5 minutes in most instances to get help. It may be difficult to manipulate an adult-sized student that is having a seizure. Call the nurse if possible. Remember, the student may be incontinent, so again, provide as much privacy as possible. Remove the cap of the medication with your thumb. Lubricate the tip with jelly. Lower the student's clothing, and turn them on their side facing you if possible. This will make sure that if they roll, they will roll towards you if they move. Bend the upper leg to expose the rectum. Insert the tip carefully. The rim of the syringe should be against the rectal opening. Count to 3 while gently pushing the plunger until it stops. If it takes longer to push the plunger, that is fine, but make sure it's completely pushed in. Hold it there and count to 3 again before removing it. Once it's removed, hold the buttocks together and count to 3 again. This is 3 counts of 3. Note the time and return the medication to the kit. Give the used kit to the EMS and stay with the student. They may be disoriented or even combative when they awaken. This is normal. Here is a video on Diastat administration. This is what you will need to demonstrate at the return demonstration to show you are competent to administer this medication.
In the event that a seizure should take place, administration using the Diastat AccuDial is fast and simple. If in fact you have used this medication before, the administration is exactly the same. Let's review. First, remove the protective cover. Then lubricate the tip with lubricating jelly. Turn the patient on the side facing you. Bend the upper leg forward, exposing the rectum. Separate the buttocks to expose the rectum. Gently insert the syringe tip into the rectum, and then count out loud, slowly. 1, 2, 3, while pushing the plunger in. Count again. 1, 2, 3, before removing the syringe. And finally, count. 1, 2, 3, one last time, while holding the buttocks together. After administration, and depending upon your prescription, there may be some unused medication left over. Remember, this prescription was for 15 milligrams that was dialed and locked from a 20 milligram Diastat Accudial diazepam rectal gel delivery system. That means that 5 milligrams will have to be disposed of. All you do is pull on the plunger until it is completely removed from the Diastat Accudial. Point it over a sink or toilet. Replace the plunger and push until it stops. Then just flush the toilet or rinse the sink until all of the gel is gone. As for the delivery system itself, just throw it and all other used materials in the trash and away from children, just as you normally would. And if you have any other concerns, don't hesitate to call your doctor or pharmacist. They'll be glad to answer all your questions about Diastat Accudial diazepam rectal gel. I hope this video helped you learn about Diastat Accudial and how it works. Having your medication with you at all times can be reassuring in case a seizure should occur. Remember, if you have any questions about your medication or Diastat Accudial, ask your doctor or pharmacist or visit our website at www.diastat.com. Thank you.
This ends Module 3, Emergency Medication. Module 4, Local School Districts Policies and Procedures. The Kenton County School District medication policies and procedures and required forms are located in the nurse's office for easy access. These policies and procedures address how medications and other health services will be delivered. The information is also available on the district's website under Health Services Department. Medication administration forms, including self-carry forms, must be signed by both the physician and the parent guardian and are valid for the current school year. We cannot accept physicians' prescriptions or notes from parents, even for over-the-counter medications. Now it is time to take the open book final exam. In addition to the training manual, you can use the study guides or any notes you have taken. As mentioned at the start of this training, depending on the format of the training, you will either take the final exam online or print the exam and bring the completed exam to your return demonstration. Thank you for your time and willingness to assist health services in addressing the medical needs of students in the Kenton County School District. The Medication Administration Training Manual and a PowerPoint of the Kenton County School District's policies and procedures are available on the district's health services webpage. If you have not already done so, please register for a return demonstration class. If you have any questions, please feel free to email me.